So here we're going to be talking about the skeletal system, and we're going to be covering several different things. We're going to look at the skeletal system in regards to its structure and its function. We need to understand all those various functions of the skeletal system, as well as you need to understand what and how many bones there are and what the functions of the different bones are. So our skeletal system is made up of organs called bones, and this is living tissue. They're very important in regards to our ability to have any form. They serve as a framework for our body, and without them, we just kind of be little lumps because we're not well formed enough. We couldn't do the kind of worm type of thing. We really need them to give us our structure. They also surround and protect our vital organs. So, for example, the heart and the lungs, in the thoracic cavity, and are in the pelvic girdle. They're going to protect our kidneys and so forth. Bones are also important in regards to the amount of calcium we could store. They're a major store of calcium in the body. And they're incredibly important in regards to our production of both red and white blood cells. So this is hematopoiesis or hemopoiesis, the production of blood cells. And they help us to move. So where the muscles attach to our different joints where bones attach together, that gives us movement. So on this slide, you can see various different parts of the skeleton. You can see the skull, and you can see the various vertebrae in the front. You can see the ribs, as well as the shoulder girdle, the pelvic girdle, and then our extremities and the long bones that are included in the extremities. So our bone structure, we have 206 bones, or the adult does normally have 206 bones. And these bones are various different shapes and sizes. We have flat bones and short bones, irregular and long bones, and they all have different functions within that skeletal system. So they're not all shaped the same clearly, and different types of bone shapes actually have different functions within the body. Bone tissue, this is called osseous tissue, and it's composed of these stony deposits, so of calcium salts, and that's really what's giving us that hardness to the bone. We do consider bones to be an organ. They are alive, they are replicating, and they are reproducing, and they are dying. They're putting on all the functions of life, so that's why we consider bones to be alive. And basically there's two main types of tissue within bones. It's compact bone, that's that hard dense stuff. That's what we kind of typically think of as a bone. And then we have that nice spongy stuff. This is in the end of the long bones and the center of some of the other ones. And these are this is where you find things like red marrow. And we'll talk about that a little bit more in just a minute. So long bones are the bones that we are most familiar with. These are the bones of the extremities. And the long bones are composed of different parts. So there's the diaphysis, and this is the shaft of it, or the main portion of it. And then we have the ends, and those are the epiphysis. Within the center of the bone, there's something called the medullary canal, and this is a cavity in the long bone. This is super important because it is filled with yellow marrow. Now when we think about yellow marrow, it's composed mainly of fat cells, and that yellow marrow is very important in regards to forming different leukocytes, or white blood cells. So leuko means white, cytes is cells, so therefore leukocytes means white cells. In addition to the yellow marrow, there's the endosteum. This is the membrane that lines the medullary canal, and it keeps the yellow marrow intact and is also helpful in bone growth. And then we have the red marrow. So red marrow is found in certain bones like the vertebra, ribs, sternum, cranium, and some of the proximal ends of like the long bones such as the humerus and femur. And that produces red blood cells, platelets, and white blood cells. It's very important in also in that immune response. So that red marrow along with the yellow marrow, both very important. But if you think of red marrow and yellow marrow from a standpoint of, when we're consuming animal products, that is really where we're getting a lot of flavor from. So we talked about that earlier when we looked at nutrition, that fats supply a lot of the flavor. And so again, in those bones, that's part of the reason that we use bones in soup and so forth, because we're going to get that flavor. Now in long bones, another portion is the periosteum, and that's a tough membrane that covers the outer aspect of the bone. And it is going to have blood vessels and lymph vessels. You'll learn a little bit more about those as we move through the different sections. So in addition, it's also going to have specialized cells that are the osteoblasts. So osteoblasts are the cells that form new bone tissue. Now, this is not necessarily in the slide, but another term is osteoclast, and those are cells that break down bone tissue. The periosteum, again, very important when we're talking about bone growth, repair, and nutrition. So another important part of the bones is something called articular cartilage. And the articular cartilage is going to cover the epiphysis of the bone. So that's the end. All right, just so you know, as I talk about this stuff, if you hear my puppies in the background, I'm sorry, I did this all at school once, but none of the audio worked on it, so I'm doing it again, and my puppies are in with me, and sometimes they cry, so I apologize for that. Anyway, so that articular cartilage, that covers the epiphysis. The epiphysis are the ends of the bones. And the cartilage is really important because it helps to act as a shock absorber where the two bones are meeting. And again, where two bones meet, that is called a joint. So here you can see a picture of the long bone. You see that proximal epiphysis. So the proximal epiphysis, proximal, as you learned earlier, proximal means near or close to the body. So that is the end of the long bone that is closest to the body, whereas the distal epiphysis, that is the end furthest away from the body. And then on the diagram, you can see the various parts of the bone. And again, to review, red marrow, this is found at the ends of the long bones and the center of some of the other bones, and is really responsible for the manufacture of red blood cells, hematopoiesis. And yellow marrow found at the central cavities of the bones, and this is composed of fat, but also important in the production of white blood cells. Now, when we talk about the bone membranes, just as a review, these are going to have cells that are going to help form bone, the osteoblasts. The periosteum covers the outside of the bone, whereas the endosteum lines the marrow cavity. So peri means around or surrounding, endo means in or within, so that can help you remember those. So when we talk about the formation of long bones, this actually begins in the center of the shaft and then continues outwards towards the epiphyseal plate. Now, as bones are, when a baby is conceived and development is occurring, those bones kind of start at the center and then work their ways out. And then as you grow and, as you continue, your bones are continuing to grow, a lot of that growth then is happening at the epiphyseal plate. We call this the growth plate. This is of concern for many young people, especially young athletes, when they break a bone and it disrupts the epiphyseal plate. It may be that that bone then, the growth of it is going to be disrupted. So they may never have the appropriate grown or bone growth. Now, that can be corrected with various different procedures, but again, it's much easier just to grow normally than have that growth plate or epiphyseal plate disrupted, and then you have to kind of intervene otherwise. Okay, so when we think about the skeleton is divided into two main parts, the axial skeleton and the appendicular skeleton. So the axial skeleton, this is the main trunk of the body, and it's going to be comprised of the skull, spinal column, ribs, and sternum, whereas the appendicular skeleton, this is the shoulder girdle and the extremities. So axial, we kind of have that center skeleton, and the appendicular, we kind of have then the extremities coming off of that. Now, when we think about the skull is composed of many different bones, and it's going to compose both the cranial bones or combine the cranial bones and the facial bones. Important function of this is to surround and protect the brain. I do want to just mention the fontanelles. So I don't know how many of you have ever worked with a baby, especially a very young baby, but when they're born, their little heads are very moldable. So, and this is real important as the baby is being delivered through the birth canal, because oftentimes that little head is just too big to get through. So that skull has got to be able to kind of mold as it's going through. And one of the things that allows that to happen are the fontanelles, and we call those the soft spots. So the fontanelles allow for the molding of the skull during the birth process, but it also allows for enlargement of the skull as the brain grows. So those are the soft spots in a baby's skull. Now, as adults, clearly those should have been filled in and become hard bone as they grow. When you look at the skull, you can see the areas where the cranial bones have joined together, and those are called sutures. So actually, sutures are a specific kind of joint that we'll talk about a little bit later. Also in the skull are the sinuses, and sinuses are kind of cool, but also for many people very much of a pain. So the purpose of sinuses really is to kind of warm and moisten air, and also gives our sound to our voice. It helps kind of determine what we're going to sound like. But also they're really important to lighten the skull, because if that was all just solid bone, our skull would be very, very heavy, and it would be very difficult to hold the head up. The foramina, those are the areas that allow nerves and vessels to enter and leave the bone. So they're those little tiny holes kind of that are going to house those. So when we think about the different bones and the different parts of the skeleton, the cranial bones are the bones that are going to make up the skull. And there are 8 bones of the skull. This is going to surround and protect the brain. We call them the frontal bone, the parietal bone, temporal bone, the occipital bone, and then the ethmoid and sphenoid bones. And if you look in your book, you'll be able to see, pictures of those different bones. You are expected to kind of know the bones of the skull, as well as the bones that make the facial portion of the skull. So this is the anterior portion of the skull. And there's 14 parts that form 14 different bones that make the facial features. We have the mandible, which is the lower jaw, the maxilla, which is the upper jaw, the zygomatic bones, those are your cheekbones. I actually had one of my zygomatic bones cracked at one point in my life, and it is very painful. You have the nasal bones. A lot of times when we talk about a broken nose, the nasal bones themselves are not actually broken, but the cartilage that attaches to the bone separates from the bone, and that they consider that, they talk about that as a broken nose. The lacrimal bones, these are in the inner aspect of the eye. And then the hard palate or the roof of the mouth are called the palatine bones. And in this graphic, you can see those different structures, the maxilla, mandible, etc., of the skull. Now, when we think about the vertebra compose the spinal column, and we have 76, I'm sorry, we have 26 bones in the spinal column, and the job of these bones is to protect the spinal cord. So these bones also help to support the head and then the entire trunk. At the top of the vertebra, the first 7 are called the cervical vertebra. So cervic means neck. The next 12 are the thoracic. So thorac is chest, so the thoracic. And these thoracic vertebra are also going to attach to ribs. After the thoracic vertebra, those 12, we look at the lumbar vertebra, and there are generally 5 of those. Now, I will tell you that there are some people with very long torsos, and you can see them, they just have these very long bodies, and they will oftentimes have an extra lumbar vertebra. So if we count them down in somebody and there is an extra vertebra, they generally throw those into the lumbar vertebra. And then there's the sacrum and the coccyx. The coccyx is the tailbone. Now, in between each vertebra, there is something called an intervertebral disc. That disc is a pad of cartilage, and it's really very complex. Within that pad of cartilage is a gel-like fluid, and sometimes what can happen is that gel or that the cartilage surrounding it can kind of crack or form a leak, and some of that gel will leak out, which can cause all kinds of problems. Or in addition, sometimes those discs will kind of bulge out and can cause various problems. We'll talk about that in just a second. So what do the intervertebral discs do? They act as shock absorbers, so that we're not crunching down on all those nerves coming off of the spinal column. And these allow us to bend and twist and move the spine in all those amazing ways, truly, that it can move. So this is a graphic of the spinal column, and you are going to be expected on a test or a quiz to be able to fill this out. So you're going to have to know that the top portion are going to be the cervical vertebra, so you're expected to know that those are the cervical vertebra, and follow down the thoracic, down to the lumbar, and the sacrum, and the coccyx. And in addition, you're going to need to know how many of each vertebra are in each section. So the next portion is the ribs, and ribs are really kind of cool. So we have 12 pairs of ribs. So these are long, slender bones, and they wrap around, they're attached to the vertebra and the thoracic vertebra, and then they wrap around and they form this cage, and that cage then is going to protect our vital organs like the heart and the lungs. And of these ribs, the first 7 pairs actually attach right to the sternum. Now, the bone attaches to the sternum via cartilage, so it's going to wrap off of the vertebra and then attach to the sternum via some cartilage. The next 5 pairs after the first 7 are going to be what are considered our false ribs. The first 7 are true ribs, the next 5 are false ribs. And those ribs, they connect to the sternum, but they don't connect directly. So what happens is that those bones, the first 3 of the false ribs are going to attach to the sternum, but first they attach via cartilage from one of the other ribs. And if you go over to the skeleton and take a look at those ribs, you'll see what I mean. So the first 7, the cartilage attaches directly to the sternum. The next 3, those false ribs, attach to cartilage that attaches to the sternum, and then the last 2 don't attach to the sternum at all, and those are called our floating ribs. They only attach to the body via the vertebra. Now the sternum, this consists of the breastbone, and the breastbone, we think about that, it's kind of that middle bone. It has the 2 clavicle, we call those collar bones, and those are attached by ligaments. And then again, the ribs are attached via cartilage and form the shoulder or pectoral girdle. Has the 2 clavicles or collar bones, as well as 2 scapula or shoulder bones. And these, the scapula, provide for attachment of the upper arm bone. Next, we have the bones of the arm. So the bones of the arm, you have the humerus, radius, and ulna. And the humerus is going to be that large upper bone, upper arm bone. Whereas the radius and the ulna, those are the 2 smaller bones in the forearm. And the radius, you can remember which side that goes to because you take a radial pulse, and the radial pulse is always thumb side. So that's the smaller of the 2 bones on the thumb side. The ulna would be the larger bone, and that would be pinky side. And also attached to the ulna is well, not attached, but the end of it is called, it's a process. It's called the Old-Cranium process, and that's really what the elbow is. The carpals are the 8 wrist bones on each hand. So I would write that down, 8 wrist bones on each hand. And the metacarpals are 5 bones on each hand that form the palm. Now the phalanges, those are our fingers, and the phalanges, there's 14 bones on each hand, which form our fingers and thumbs. 3 on each finger and 2 on the thumb. And here is a picture. You can see the different bones of the upper body. Bones of the pelvic girdle. These consist of 2 os coxae, or the kind of the hip bones. And each hip bone has 3 regions, the ilium and the ischium and the pubis. Now an important thing about the pelvic girdle is that it joins the sacrum on the dorsal part of the body, and there's a very important joint here, which is the symphysis pubis. So that joint, it's on the ventral portion of the body, and again is very important, gives us a little bit of movement in our hips. So I know it feels like when you think about your hips that it's just kind of one structure, but there really is some movement between the right and the left side, and that is due to the symphysis pubis. The acetabula, these are the hip sockets, so this is where the femur is going to fit in. Now the femur, this is the large upper bone of the lower extremities. In addition, you have the patella, and that would be the kneecap. The tibia and the fibula, those are the 2 smaller bones in the lower leg, and you can remember which is which if you think of them as there's kind of opposite. So you have tibia and fibula. Fibula being the longer word, but fibula is actually the smaller bone. Tibia is the smaller word, but is the bigger bone. You also have the tarsals. Tarsals are the 7 bones of the ankle, and the calcaneus is part of that ankle. The calcaneus is actually, that's our heel bone. Then we have the foot bones, the metatarsal, and there's 5 bones that form the instep of the foot. And then we have our phalanges on the foot, and that's going to be our toes. We have 14 bones on each foot that form the toes, 2 for the great toe and 3 for each of the other toes. Here you see a dorsal or back look at the skeleton. So what is a joint? A joint is where two or more bones join together. And we have various different types of joints. We have diarthrosis, amphiarthrosis, and synarthrosis joints. Now, I do want to just let you know that when joints where you have bones coming together, the things that make those bones come together, what those are called are ligaments. So ligaments are connective tissue that bands or bones together. Um, so that's what you're going to find in joints. So if they tell you that you have damage to a ligament, that's the connective tissue that connects those bones. So a diarthrosis joint is freely movable, and we think about those with the hinge and socket, or the hinge joints and the ball and socket joint, sorry. So a hinge joint is going to be like an elbow or knee, whereas ball and socket would be like a shoulder and hip. The amphiarthrosis joints, these are slightly movable, and when we think about those, you can think about where the ribs join the vertebra, there actually is some movement there, as well as the symphysis pubis. That is also an amphiarthrosis joint. The synarthrosis joint, these are the immovable joints, and these are the joints that we see in the cranium. So before, when we talked about the skull and we talked about those sutures or joints where those bones came together, that's what we're talking about. They are immovable joints, and but still where the bone. So joints, where we think about joints again, that's where those bones come together. And I talked to you a little bit before. The ligaments are what attach. That's connective tissue that attaches bone to bone. And just so you know, tendons are going to attach muscle to bone. So another component of joints that's pretty important are the bursa. And the bursa are small fluid-filled sacs that surround the joints. And these really are important when we talk about some of those pathological conditions or disease conditions. If something happens in the bursa, it can cause quite a bit of discomfort and pain. When we think about the disease conditions or abnormal conditions, arthritis, arthro means joint, itis is inflammation, so that's inflammation of a joint. Now there's lots of different causes of arthritis, but it's broken down into two main types. We have osteoarthritis and then rheumatoid arthritis. Osteoarthritis, very common. This is going to occur with aging. You're going to end up with inflammation of the joints, which is going to, some swelling, some stiffness, aching. You might have some limited range of motion. Some of the things we can do for that, you can use anti-inflammatories. We use ice. Rest. We also use some heat applications. Sometimes we'll use steroid injections to help with that. Versus rheumatoid arthritis. Rheumatoid arthritis really is an autoimmune disease, and for rheumatoid arthritis, this is a chronic inflammatory process that really destroys bone tissue, and you will see these at the joints. You'll see some incredible deformities. I have seen people with hands and feet that are so deformed from that rheumatoid arthritis. It's just very, very sad. It's very painful, more common in women than in men. And really, now they have all kinds of different kind of biological treatments that they're using, each with their own cost. Sometimes we can do some surgery, but a lot of times people just have to learn to live with that. Bursitis, this is that when we talked about the bursa, those sacs. Bursitis means inflammation of those sacs, and you can end up with a lot of fluid on there. So again, different things to decrease inflammation we might do. They might actually need to go in and aspirate or pull out with a needle some of that fluid. Physical therapy might be used, various different pain medications, etc. Dislocation. Dislocation is not a comfortable thing to happen. This is when a bone is forcibly removed from the joint. It occurs oftentimes in like shoulders and fingers or knees and hips. And really what needs to happen is you really need to see somebody that can put that joint back into place. Now, sometimes um, that it will spontaneously occur, um, but this is pretty painful. There's damage done to that joint. Oftentimes there's going to be inflammation and damage to some of the surrounding tissues. So you really need to have some medical intervention there. A sprain, this is a twisting action that tears the ligaments at a joint. Common sites are where like at the wrist and the ankles. And really, sometimes a sprain can cause somebody more disruption in their activity than even a break. A bone will heal fairly quickly. Sprains don't always heal quite as quickly. There's a lot of pain and swelling, some discoloration, a limited movement associated with those. And really, we look at that RICE treatment, rest, ice, elevation, and some compression in there or immobilization, but it just really depends on where it's located and the extent of that sprain. Now, fractures, those are a different ballpark. This is where we actually have the bone that's going to break. We have several different types of fractures. You have a green stick fracture. And if you think about when you go out and get a stick to roast a marshmallow, you always kind of want a green stick because it's not going to burn as fast. It's not going to catch on fire. Well, if you bend that twig or that green stick, what happens is the bottom of that bows and doesn't break, but the top of it then splinters. And we see that that's the kind of thing that we're seeing in bones in a green stick fracture. And we see that in little ones before their bones are fully ossified. So a simpler closed fracture, this is a complete fracture in the bone, but there's no disruption to the skin. It's not like the bone is sticking out through the skin or anything. Whereas a compound fracture, the bone is actually going to stick out and rupture through the skin. You're going to have bleeding. You're going to see those pieces sticking out. This compound fracture is never a pretty thing to see. An impacted fracture, this is where the broken bone ends actually jam into each other. There can be quite a bit of disruption, and oftentimes in an impacted fracture, because it's kind of crushed those bones, sometimes again you need pins and surgical intervention for those. A comminuted fracture, this is where the bone fragments, there's just splinters into more than one piece. Again, we're looking at sometimes that's not going to heal on its own. Oftentimes, and you need surgical intervention. They go in and put some pins in there to hold stuff together. A spiral fracture, you'll see a spiral fracture. This results because the bone, it's twisting in one or more of those breaks. And when we think about a spiral fracture, sometimes that, depending upon what the cause was, that can be a red flag for us. What happened that bone got twisted. But you also see those in skiing and skating accidents. They're pretty common. A depressed fracture, this is not generally real happy. This is where the skull has broken, and you actually see a piece of that skull kind of depressed down. That's kind of dented. You see it going down inward. Depressed fracture, we're looking at a pretty severe head injury there, and that's a medical emergency, definitely. A Cole's fracture, this is where there's breaking and dislocation at the distal end of the radius, and you'll see this very characteristic bulge at the wrist. And this is caused by falling on an outstretched hand. So we'll see this pretty commonly in people that have fallen forward and they're trying to catch themselves. Now, the term osteomyelitis is actually inflammation of the bone, and this is caused generally by some kind of pathogenic organism. Very difficult to deal with. We're going to need some high-level care in there, certainly antibiotics. Sometimes you need a surgical intervention in that. Osteoporosis is where you lose bone density, so the bones fracture very easily, and you can actually have pathological fractures of the bone. So they don't need to fall, they don't need to put any stress on the bone. Sometimes just the simple act of moving the bone can cause a fracture. And then we talk about ruptured discs. We see patients with ruptured discs, or people will tell you they have a rupture. What they're talking about is that intervertebral disc protrudes out of place. But I'm going to tell you, I did a lot of work with backs and back injuries, and I actually did quite a bit of some study and gathered a lot of data on this. And interestingly, the discs, we see people with ruptured discs all the time, and they're totally asymptomatic. They don't even know it. The only reason you see the ruptured disc is because they're getting an MRI, for some other reason, and then you say, oh yeah, there's a ruptured disc, but it doesn't actually cause them any symptoms. So it depends on how that disc is rupturing and where it's rupturing as to what kinds of symptoms you might have. And then finally, we have some abnormal curvature of the spine. And again, we'll see this not necessarily just with the elderly patient, but some people have this at a very young age. So kyphosis is kind of your typical hunchback. So if you think about the Hunchback of Notre Dame, where you see that big kind of lump at the base of the cervical spine in the back, and they're kind of hunched forward. That's kyphosis. Scoliosis, this is where there is a lateral curvature to the spine, so the spine actually goes off to the side, one side or the other, versus lordosis, we call that sway back, and what happens is the spine, instead of like in kyphosis, it's kind of going backwards, so that bulges backwards, whereas lordosis is kind of inward, and it's generally to the lower spine. So those are some of the different abnormal conditions or diseases you can see associated with various different skeletal structures. So you've covered quite a bit here today, and there are some things that we talked about that maybe were not on the notes. You need to go back and make sure you take notes on that, because there may be some test questions associated with that. For example, I gave you a little more information on sprains. I gave you a little more information on some of those different bones and the formation of bones. So you're really going to need to go back. You might need to listen to it twice. Make sure you get this information.